Hello guys, I'm Deepak Shukla. Welcome to our channel Study Menu. Today let's learn about topic CSOM, chronic suppurative otitis media. What do you mean by chronic? The duration more than 12 weeks. Duration more than 12 weeks and suppurative means infectious. So CSOM is a long-standing infection of a part or whole of the middle ear cleft characterized by ear discharge or permanent perforation. So what is permanent perforation? When do you call it as a permanent perforation? When the edges of the perforation is covered, when the edges of the perforation is covered by squamous epithelium and does not heal spontaneously, we'll call it as permanent perforation. Okay, so it is characterized by ear discharge and permanent perforation. Okay, now coming to the types of CSOM, we have tubotympanic type and aticoantral type. Tubotympanic means starts from the tube and ends through the tympanic membrane. Aticoantral means start from the attic bone and ends till the antral. So tubotympanic start from the eustachian tube, ends to the tympanic membrane. Aticoantral means from the roof of the middle ear till the antrum. Okay, antrum is the mastoid, like antral cells of the mastoid. So this is about the types of CSOM. So coming and learning each one of them separately. First we have tubotympanic type. Okay, so you know the source. The source is eustachian tube and then it affects the tympanic membrane. It is often seen in younger age group. Why in younger age group? Because in them the eustachian tube is shorter, straighter and more horizontal, allowing easy infection. What is the etiology behind that? The etiology can be nasal, nasopharyngeal, palatal. Okay, nasal like any polyp, any kind of tonsillitis, repeated infections, that can be the cause. So what happened due to those? There is chronic increase in the negative pressure, and when the negative pressure is increased, there will be pus formation. Okay, so the middle ear is filled with pus, and that is profused pus. So in CSOM, you will see profused pus. Okay, so how they'll complain that while lying down on the pillow gets wet. Okay, while lying down on the pillow gets wet. That is how the profused discharge is expressed, and it is mainly in the antero-inferior part of the middle ear is affected. If perforation is there, it is mainly in the antero-inferior part of the middle ear. Large amount of mucosine is involved, therefore profuse pus, thus I have told. Perforation is in pars tensa. Okay, perforation is in pars tensa because antero-inferior part, so mainly it is in the pars tensa. Okay, whereas in the other part it will be in the pars flaccida because roof is involved, so roof is near to the pars flaccida, so pars flaccida is involved. Okay, it will be non-foul pus and non-blood stained, whereas in the aticoantral type it will be foul smelling and blood tinged because bone is involved there. Here hearing loss is there but not as much as compared to the aticoantral type. Complications are lesser and it is a safer disease comparatively, and if you see the polyp it will be pale polyp. Now coming to the aticoantral type, first of all I want to say that it is a unsafe disease. It is unsafe disease because bone is involved. So due to the erosion of bone, you'll having foul smell and blood tinged, but the discharge is not that much. Okay, it is very less in amount. So let's know. Source is atico, that is the roof, and goes to the antrum, that is posterior part to the mastoid. Okay, it is usually associated with cholesteatoma. It is often seen in older age group, and the part involved of the middle ear is posterior superior. Therefore, if there is perforation, it will be in the pars flaccida. Posterior superior part is involved. Scanty pus and small middle ear is involved because of that. Perforation is seen in pars flaccida, as I have told. It is an erosive disease. It can erode the tegmen bones or any surrounding structures, which lead to foul smelling and blood stained. Hearing loss is profound. Too much of hearing loss is there due to ossicle erosion. Risk of complications is more. because of the tegmen erosion, ossicular erosion, osteotitis, facial nerve erosion. It is an unsafe disease, and if there is polyp, it will be fleshy polyp. So this was about the tubotympanic type and the aticoantral type. The differences between the source, okay, associations, okay. Then what about the etiology? Etiology, it is mainly associated with cholesteatoma. It is in older age group. It is in the younger age group. Okay, it here will be profused pus. Here it will be scanty pus. Like if you'll put fingers in their ear, they can feel that pus. So this was about the difference between those. Now coming to the investigation, here examine the ear under the microscope. Okay, so otoscope will help and look for the permanent perforation. Okay. What was permanent perforation? I have told you earlier. Now evaluate any pathology, that is palatal cause, nasal cause, nasopharyngeal cause, by diagnostic nasal endoscopy, or go for CT scan of nose and paranasal sinuses. High resolution CT scan for temporal bone is must. Why? To know the extent of the disease and the area involved. Mastoid X-ray will also help to know the sclerotic and extent of bone destructions. Audiological evaluation is also very important for any medical legal aspect, before the surgery and after the surgery, to evaluate. Okay, so to compare hearing pre and post operation. So this was about the investigation. Coming to the treatment. Depending upon the type of CSOM, that is tubotympanic or aticoantral, the treatment varies. Tubotympanic being a safe disease, here first we'll treat the underlying cause, then go for the surgery, and we can have some oral toilet, antibiotics, ear drops, and then we can go for the surgery, that is laryngoplasty and tympanoplasty. Whereas in aticoantral, that is unsafe disease, so here we have to prevent the complications first. Therefore, first go for the surgery that is associated with cholesteatoma, and try preventing hearing loss and complications later. So first go for the surgery. So go for modified radical mastectomy. Okay. Then go for the reconstructive surgery, that is laryngoplasty, tympanoplasty, reconstruction of fascicular chains. Okay, so in safe disease, first treat the cause and then go for the surgery. But in the unsafe disease, that is aticoantral, first go for the surgery, try to prevent the complications, then go for the reconstructive surgeries. So that was about the just outline about the treatment. There is some classification of CSOM. We have mucosal disease and squamosal disease. Mucosal is again safe and squamosal is unsafe. Okay. So in mucosal disease, we have active and inactive. Inactive, if the discharge is present, it is called active mucosal disease. If it is inactive, there is no discharge. Okay, so mucosal, active and inactive. Again in squamosal, we have active and inactive. Active means it is associated with cholesteatoma, and inactive means quiescent stose. So this was the classification of CSOM. There is one entity called tubercular otitis media. So let's know about 2-3 points about this. In tubercular otitis media, we have multiple permanent perforation. Multiple permanent perforation. It is painless, though foul smelling, associated with facial paralysis, and there will be severe hearing loss out of proportion for symptoms. Means hearing loss will be more, but the symptoms are less. Okay, so this is about the CSM and tubercular otitis media. Thank you so much.